everyone, and welcome back to my channel. And for today we are going to be talking about the comparison between the day shift and the night shift. And I will be talking about in regards with my experience and which one I do prefer. So if you find this video interesting, please keep on watching. So I was on night shift for about 3 years in my current job, and then I switched to day shift, and it's been like almost a year now. But prior to that, I was working in skilled nursing facility, and I do both, like a variable shift. I know I'm crazy like that. Well, before I was still young, fresh, and full of life. So let's talk about patient load, or what we called nurse to patient ratio. And here I'm just talking about the ideal in med-surg settings. So day shift gets 4 patients and night shift get 5 patients. I know, 4 patients sounds like, I'll take that. But nope.
It's busy.
So if you work on night shift and you get that 5 patients, that is your sweet number. I really like that because sometimes charge nurses give you 4 patients, and that means you get the next admit. And having that 5 patient from the start of your shift, that's actually an advantage for you because you kind of have this idea on what's your 12-hour shift looks like. Not unless your patient coded and then you have to transfer that patient to the ICU, or your patient's expired, or someone wants to leave AMA, and those are circumstances that you cannot control. For the day shift, it doesn't matter if you're gonna start with 3 patients or 4 patients, it's super busy. So let's say you'll start with 4 patients and then you'll end up discharging 2 patients. So let's say you first discharge 1 patient and then you'll get an admit, and then you'll discharge another patient and then you'll get another admit again. And those discharge process, it will take you a lot of time. Like you have to communicate with your doctor, you have to communicate with the pharmacies, like if a patient gets medication, so you have to call them and make sure that the patient leaves with their medications. You have to communicate with social worker, with case manager. What else? You have to call the family and let them know, or ask them to give these patients a ride, something like that. So it can be really like time consuming, especially when you're doing your discharge and also the admits. Okay, so now let's talk about the pay, the money. So night shift nurses get this sweet night shift differential, and that is huge. That's a lot of money. So on top of what you're making and then the night differentials, that is like gold. Compared to day shift, of course, we just get the regular pay. That's what I really miss, working on night shift, because I really noticed like it hit my paycheck really hard. And now I have to cut back with my expenses, especially with my shopping. I know, it's really sad. Just like nurses Blake mentioned, like comparing it to avocado toast and toast, or like shopping to Nordstrom or Nordstrom Rack. And now let's talk about the life of a night shift nurse in comparison to a life of a day shift nurse. I know some of my coworkers that works at night, they are very well adjusted with their time schedule, and they were able to make time for their family, their friends, and they were able to make time for a me time, which on my case, it didn't work. I was really having a hard time sleeping when I was on night shift. I feel super tired every time I go to work. I don't have any energy, and that's when the time that I started taking sleeping aids like melatonin to help me with the sleep. But what happened is that after like after I took them and then I go to sleep, I woke up and I feel so drowsy. So it's really not helping me. And it makes your body confused when you work night shift. Like your night shift schedule and then days off, you're normal, and then back to night shift again, and then your days off, you're normal. It's really confusing your body. And sometimes when I go to work and then I will ask my patient, what day is it today? Even I could not answer that simple questions. I am confused AF. And now let's talk about a life of a day shift nurse. Simple. Working during the day, sleeping at night, doing your errands during the day, sleeping at night, awake during the day, sleeping at night. No complaints. Normal. Totally normal. And now let's talk about the resources and the pays for both shift in comparison for day shift and night shift. Night shift, you will probably have 2 to 3 doctors in-house doctors. It depends on how big the hospital is. You will have a house supervisor, a charge nurse, your co-nurses, nurses, and RTs. And I think that's about it. Pace. It's more quiet. Uh-oh, did I say the Q word? Not often, but it's calmer, I would say, because no one is walking around like the managers or the administrations, like they're not there during the night shift. So day shift, you have everyone, doctors, specialists, consultants. You have your the PT, the OT, the speech, dietitian, pharmacists been calling you about medications, family members, chaplains, social worker, case manager, like name it. They're all in there asking about your patients. So having all these resources during the day, it can be a pros and cons, but definitely day shift is a really fast-paced working environment. And sometimes you don't even notice that it's been 12 hours and it's time to go home. So which one do I prefer to work, day shift or night shift? My body prefers to work day shift, but other than that, I like working night shift because of less stress, good money, and also a good teamwork during the nights. But then at the end of the day, it doesn't matter if you work nights or day, it's always a teamwork. You show up to work, you care for your patient, you do your job. That is nursing is all about. All right, thank you guys for watching, and if you like this video, please give it a thumbs up and let me know down in the comments if you want to see more about this topic, and please subscribe to my channel. Thank you so much and God bless.